What's up, everyone? Welcome back to the Daily Sean. If you haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably won't change. Today's topic is sparked by a comment that was placed on last night's video. Kind of got me curious. I decided we should put our thinking caps on today and let's discuss. Maybe we'll call it discussion hat. Discussion hat? Debate hat. I don't want to call it a debate. Let's call it a discussion. Thought-provoking question. I want to know what your thoughts, what your feelings are, what your experiences are with calling patients honey, hun, dear, any of those terms. Instead of calling them by their first name or calling them Mr. or Mrs., have you ever heard, would you ever use the terms honey, sweetie, dear, hun, all of those terms? Now, of course, this kind of rules out the option of calling a male patient that. That I think would be purposely being derogatory. We won't use that as an example. Someone had made the comment, those terms could be interpreted as derogatory or demeaning or negative in some way. And I had to think about it for a couple minutes. I myself have probably been guilty of using the term. I never used it in a negative or derogatory manner. I think I've called patients dear before, but never hun, honey, sweetie, anything like that. I don't know, that just kind of gets under my skin. But I also don't consider it to be offensive. I don't consider it to be derogatory. It also depends on your geographical location of where you practice. I know that in the southern states, and I, at the risk of sounding stereotypical, in the southern states, that is a term of endearment. Term used, that is a common term of greeting. Up here in the north, I don't think we use that as a common term. Now, you could also start talking about how certain generations are used to using those terms. The older generations that are decades older than me. And we're not going to sit here and start talking about age because I don't feel like getting all kinds of hate mail. In the later years, that using those terms has also been commonplace as a term of endearment or as a term of greeting. So what I want to know is, from your perspective, from the fan perspective, from our tribe, what do we consider these terms to be? Are they derogatory? Are they offensive? Are they endearing? Would you use them yourself? And or if someone was using the term, would you approach them and tell them that that may be interpreted as offensive? I would really hope that you wouldn't actually tell them at the bedside in front of the patient. I would hope that you would ask them later when you're out of the room or away from the patient. But I'd be curious to see what you say. I'm kind of down the middle on this one. I think it's all in the delivery. If you're meaning no harm, and as long as the patient is not offended, then I think it would be okay. But then, as I say those words, how do you know if the patient is offended or not? How do you know it's okay? Do you actually ask the patient, is it okay if I call you honey, sweetie? And the more I talk about it, the more I think about it, are those terms kind of on parallel, and do they live on the same level as calling your nurse babe or chick? I'm pretty sure I can't think of a nurse out there that would actually be okay with being called babe in the workplace when they're working as a professional. I had an opinion when I started this video, and I think I've already changed my mind. I'm wondering if these terms truly are offensive. Curious to know what everyone else has to say. I think we all can probably admit that we have used these terms, but do we ever consider these terms to be offensive? If we do, what do we do about it? Inquiring minds want to know. What'd you think of the video? What do you think of this topic? Love to hear your thoughts on the terms that we talked about. Honey, sweetie, hun, babe, chick. What kind of endearing term would you call a guy? Dude? I don't think dude is a good term either. Bro? No, I don't think bro is a good term either. I think this really boils down to just the female patient population, which is even more stereotypical. Curious to what you have to say about this one. Leave me a comment down below. Want to hear from you. Always appreciate a thumbs up. Share this with somebody. And as always, check your own pulse first.